Hi everyone, and welcome to our short presentation on HIV and sexual pleasure. Let me introduce my co-presenter, this is Amoy Chung, and myself, Lamont. We're both psychosexual therapists based here at the Courtyard Clinic in St George's. Okay. Well, I suppose one thing that we've both noticed over the past year to 18 months has been a real change in the patients that we're seeing. I am personally seeing a lot more couples, a lot more gay couples who present, and they present with issues in their sexual life. So I'm not just talking about male couples, we have female couples. I don't know if you'd agree with that, Amoy.
Yes, I do.
Yeah. And they're coming to us and asking for ways that they can improve their sexual relationship. And that's not easy because we get used to doing things in a certain way. And when I say that, the older you are, the more used to doing things in a certain way you are. So HIV can impact on your lives in many ways. And you've got to think of the stages that I'm sure you've gone through as you've experienced this. There's diagnosis.
But being told that you have HIV is a serious issue. But it doesn't mean that it's life-threatening as it used to be in the old days. 20 years ago it was quite life-threatening. These days it's less so. So in terms of the diagnosis, understanding exactly what does the diagnosis mean, getting as much information as you need and getting as much information from your consultants and all other professionals is going to help you in terms of preparing you for managing to cope with your life with HIV. Okay.
And it's also, I think, understanding what you want sexually, what you like sexually. Because yes, you may have to change some of your sexual practices, or maybe not. But you need to be talking to your partner, your sex buddies, or whatever else. You need to understand what you want as an individual, and maybe what they want. So it's not just falling into a box and saying, well, this is what my mates say, this is what I should be doing. It's actually thinking, what do you want as individuals? What will give you pleasure?
I mean, the other thing in terms of acceptance of self is we carry a lot of shame when we're given such diagnoses. Many other diagnoses are shaming. And if you start from a basis of accepting yourself, then it will help you to cope with what lies ahead.
Working with your medical team, I guess, is very important as a starting point to understand the effect on you as an individual, the medication you're going to be taking. How does that affect you? Are you going to be tired? Are you going to feel as though you just got no libido at all? What is the reason for that? Maybe you're working too hard. People tend to put every change of their libido onto it must be medication. That's not always the case. It could be that you're closed off in the way you approach yourself sexually. You think, I've always done this. I've always done it this way. He or she's always responded to me in this way. What I would like to do, what we would like to do, is actually introduce you to perhaps a new way of loving or enjoying sex or of getting a buzz, whatever turns you on. But you're going to have to make some changes, and that's what we want to help you with.
Yeah. Again, so always make sure you ask support, definitely from your medical team, and from anybody else who might need to be around for you. Example, your counsellors, your psychosexual counsellors, your health advisors, any of the consultants, and also any other specialist service that you might need. You might actually need to see a urologist, in terms of how you're managing in terms of your functioning, erectile dysfunction or premature ejaculation. You will need to have support with that. In terms of females, you might well have other issues which we will talk about later in terms of vaginismus, dyspareunia, all sorts of physical ailments that will go along maybe with the medical diagnosis of HIV.
I mean, I think it's quite important that this is not all tied to HIV. There's a lot of men out there that have erectile problems, premature ejaculation. It's got nothing to do with HIV. But it's amazing how some sort of trauma can impact this side of our sexuality. If you have a stroke, if you have a fall, all of a sudden, stress,
Yeah.
anxiety, all of a sudden you can't get that same effect. Again, if you put it all down to medication, it's just too easy. So what I'm encouraging you to do is to look at your complete self, every part of you, top of your head to the base of your feet. It's just thinking there's more to it. And the big thing here is getting rid of anxiety.
Yeah. Okay, so what next? Definitely you're going to probably have mixed emotions. And you're going to be angry. You might be more anxious because you're not getting the information that you need. And coming to terms with the diagnosis itself is difficult. So from what you were before, you're going to be something different now. You're not going to be the same person. You're going to be the same person with HIV diagnosis. And coming to terms with that will more often than not bring you into a grieving situation where you're grieving how you were before and how you're going to be now.
Okay, and I think part of that to me is very much being able to communicate with other people, not just health professionals, but meeting with other guys or women who are experiencing a similar trauma and that maybe can share with you how they deal with it. Because it's all very well going to professionals. I think you can learn a lot from talking to other people.
Yeah.
Opening your mind to various channels of communication. Lifestyle changes, you know what you were talking about there. Safety should still be paramount. And it's thinking about how can I be safe and still enjoy sex. Because I think for a lot of people, men, women, gay, straight, whatever, we don't always think of what's safe, we just think of what's enjoyable. And that takes precedence over safety. But no matter if I can't tell if anyone's got HIV by just looking at them, but internally you still have to keep yourself safe. You have to think about what you can enjoy, what you can play with, but then how can I keep myself safe? Because it's not just going to happen without some care and thought.
You might not actually want to have sex. It might actually stop you in your tracks and think, well, you know, has sex got me in this situation? Has risky sex got me in this situation? Do I want to have sex? I'm so scared of having sex. And who's going to want to have sex with me?
Yes. Am I still, does someone still fancy me? Am I still sexual to my partner or to the world in general? And, you know, it's interesting, I think at different ages we probably see this differently. You know, I'm a lot older than some of you, and I think probably I have a different view of it to perhaps I would have had at 20. But we're still sexual beings, you know, there's no reason why we can't be sexual right up to the last day, if that's what you want to be. But you have to, if you have to think about how you're going to safeguard that part of you and enjoy it.
Yeah.
But I'd like just to get you thinking about other ways of turning yourself and your partner on. Now, that could be touch, taste, odours, smell, perfumes, aromatherapy oils. I don't know if you've tried any of that. It's something different. You're now approaching the sensual side of a sexual experience. And I don't know how many of us actually understand what that means. You think you enjoy sex, it's really a real turn on, but is it really sensual? Do you know on your body where those places are that would be sensual? You know, the erogenous areas, as they call them, I think. It's thinking, if I get touched there, does that turn me on? Or do I have to be treated in a certain way to turn me on? It's just thinking about your bodies. So if you're in the shower or in the bath, do you ever touch yourself and think, I wonder what it's like for someone to touch me here, there?
All your dry bits, all your sensitive bits,
your big
all
bits,
the bits that are a
big
bit
stomach.
rough. Oh yeah, big and small bits. But it's like that, when you're introduced to something that's different, it's like, you know, you walk past a chip shop and you know, immediately you smell chips and you want them, you know. And this is, I think, what we're trying to do. We're trying to open people up to experiencing different. You have a partner who, you know, touches you the same way, and you know, you have some people who don't actually say anything. They will allow themselves to be touched in the same way by their partner, and yet they're quite bored, or they're fed up with the same old ritual. And we encourage people to encourage their partner, take their hand, and to touch them how they want to be touched. You know, to stroke their bodies how they want to be stroked.
It's actually being assertive and saying, I want you to touch me here, there, or somewhere else. There's a sadistic part of me, and I often think, I say, have you ever touched feet?
Yes.
You know, and I get this, often I get a real reaction, which is feet. God, I wouldn't want anyone touching my feet. But actually, if you think about it, the feet are clean, hopefully for me, I want them clean, it can be really sensual.
It's a reflexology kind of thing.
Yeah, it is. But it's really amazing
lovely.
how being touched on the soles of your feet can really get you to respond in a way that perhaps you've never experienced. A similar intensity. You know?
I sometimes encourage people to do washing of hair. So being able to touch the hair and to kind of just stroke it, use the different kinds of hot and cold water, using different shampoos and smelling them. I mean, that's kind of loving, very loving, soothing thing to be done to a partner. Yeah. And especially if you don't want to be, you know, you're not ready to be touched physically on the body yet.
I mean, I think culturally in this country, men are not encouraged to enjoy having their bodies touched in a sensual way. I mean, I don't know how many people here have had a massage, for example.
Oh, yeah.
You know, this is not just about sex. This is about opening up a reaction. Yeah. Not just men, women, anyone. To experience something a little different. Because again, you have to look for the difference. If you're going to have a reasonable sexual relationship, you have to look at the difference. You can't just think, look, I'm 20 years old and I'm always going to be fancy and I'll always find a partner. To get to certain ages, perhaps that's not true, but I can always go to a sports massage, can't I? Which is not sexual for me, but it does relax me. You know, I feel really relaxed. It's just to think of different ways of getting pleasure.
Pain. If you're having pain, whether that's physical pain or emotional pain, there may be an avoidance in terms of wanting to have sex. Definitely pain through penetration. You can have pain through penetration, anal and vaginal sex, anadyspareunia and dyspareunia. They are experiences of pain, and vaginismus and vulvodynia, and they're different kinds of pain in terms of reflexes that we have that might be blocking of any kind of penetration. They can be just painful parts of our vaginas or our anuses.
I mean, anxiety, I think, is a huge issue sexually.
Yeah.
I mean, I deal with so many young men who are anxious about their sexuality, or feel they can't orgasm, or the moment they think of having sex, they lose their erection. And you think, why would this young guy have this problem? Yeah. He's 22, 23, he looks great, he's alive, you know, he's happy, he hasn't got any problems, but he's got anxiety. And anxiety is like a tumour, just works on you. So you've got to look at ways that will help you. And one of the main ways that I use nowadays is something called Headspace. I don't know if you've seen it on your phones. It's an app. It comes from a therapy called mindfulness, which is basically here and now, just concentrating on the here and now. If you want to have a look at it, if you've got an iPhone or one of these Android phones, you can check it out.
So it's a relaxation?
It's a relaxation, and it's to do with breathing, stretching, and positive visualization. Mm-hmm. So you experience all three. It takes about 10 to 15 minutes. And I use it and it's really helpful. It's just a way of getting over some difficulties.
Okay. So yes, if you're angry or depressed, that definitely is going to inhibit your attention to getting an erection, definitely. And also you lose your libido when you've got depression and anger going on. But all these things that are noted there are going to stop you. They're going to make you more avoidant at having sex, wanting to have sex, and sharing yourself with somebody else.
Okay. We've got a form that actually we'll hand out at the end of the session, and it's just asking you to think about what sort of touch you like, because a lot of people don't know. I have a therapy called Sensate Focus, which I encourage the couple to touch each other. But I've spoken to people and I say, well, how do you like to be touched? I don't know. I don't even know how to touch someone else. You know, they think that sex has to be something that's not light, it's not erotic, it's almost, well, of course not erotic, of course it's erotic, but it's, they don't know what sort of touch they want. So should it be affectionate? Should it be sensual? Should it be soothing? And we all, as children, understand about soothing. There are very few people that don't discover their own bodies from about the age of 6 months going on. You can touch your vagina, your penis. Boys and girls can find masturbation, and this is usually a soother. It's not just an erotic experience, it's a soother. So how can I calm myself? How can I feel better? Well, a quick bash at masturbation might do it, but after a while it gets a bit boring, I would suggest. And after doing it for 70 years...
And then you get somebody else to do it.
Oh, really? Oh, I see. Yeah, okay.
That's much more effective.
Well, as we say here, how do I like being
people.
touched?
Sorry.
Soft, smooth, hard, rough. And you know, you can do that. You can actually use different things to touch each other with. You can use a makeup brush.
Yeah.
You can use a feather.
Or a silicone brush. I always encourage people to get a silicone pastry brush.
Pastry
Yes,
brush.
I do, yeah.
Yeah, so you can try all these things. Now, I can tell from some of the reactions we're getting in the audience that you've never thought of trying these things. I mean, I have someone that gets frozen peas and rolls them down the back of their partner. Now, to me, see, that can be very sensual. At the very least, you'll have a laugh.
Yes.
And you need humour.
Yeah.
More than anything else, you need to laugh.
Yeah.
If sex is too serious, believe me, it can become very boring. You have to see it as funny. You're doing things or having things done to you, which, well, really, people outside your sexual world wouldn't even dream of you doing. So there is a funny side of it. I just hope you can find it. So what smells do you like? You know, for some people, smell is very important. Perfume is very important. But it can be the same as, I like the smell of sweat. That can be a big turn on.
Yes.
Again, someone there doesn't like the smell of
I like the smell of sweat.
Yes, I know, when you said that, I
Natural.
thought, well, there you go, it's natural. You know, but it's understanding what you like.
Yeah.
And we're all going to be different.
But it's like perfumes, isn't it? You know, going into a perfume bar and smelling all the different perfumes. You know, you just choosing one that you like. I mean, it's really good to encourage your partner to maybe experiment with different kinds of perfumes, especially that you might like.
Okay, so we'll give you this to take home, and you can experiment. Yeah, but don't close your mind. Really think about it,
Yeah.
and maybe talk to a partner about it. It's even down to what I like to hear. What sort of music do I want?
Yes. Do you like to have sex in silence? Or would you like to hear some background noise? Do you want to hear music? You know, someone talking to you, gentle, soothing noises, or loud drum and bass? You know, it depends on what turns you on.
And do I look at my partner? You know, again, I speak to people, I say, they close their eyes the moment they start having sex, and they stay closed. Now, I'm sure that's lovely. That can be really an experience, to be passive and let things happen to you. But you can't close your eyes for the whole experience.
Yeah.
I think I'd get a bit paranoid.
It
I'd
can
be
disconnect
thinking,
you,
my
yeah.
God, are they looking at me like some, you know, crazy man? I mean, I'd like them to look at me and actually get something out of it. Because mutual stimulation That's how that's created. So I'm looking at you, you're looking at me, and between the two of us, that hopefully is a turn on. If it's not, then we're not with the right people, perhaps.
And maybe it's scary to have that kind of face-to-face connection. Maybe some people are not wanting to have that kind of deep experience of connection with a person.
Yeah, well, if you're not happy with yourself, sometimes it's difficult to have someone look into your eyes. But it's a really good experience. And if you can do it, I think it'll give you an experience, it'll give you something which not everyone has. It's, you can feel really trusting. And trust is another big part of enjoying sex.
But if you're someone who's having a quickie, who just wants a quickie, and doesn't want to engage in a long-term or serious relationship, then, you know, maybe you're not going to want to give eye contact. But again, what are the things that fit in with risky sex? You know, not looking at your partner, not taking in.
It's you have to be the judge of what's right for you. Neither of us are going to be telling you how you should enjoy sex, but you know, we want you to protect yourself and maybe try something new at the same time. I mean, a big part of what we do here is dealing with dysfunctions. Now again, this is not for the gay world, it's not for the straight world, it's for all of us. And what you're seeing now are just the names of sexual dysfunctions that we can work with. Some might require some medical intervention, but most do not. They're actually part of anxiety, fear. These are the contributing factors to a lot of the problems. If you experience pain, how relaxed are you? What would happen if you use lubrication? All these things are options. Loss of desire is a big one, and that's very difficult to do something about. Or you feel that your libido is so low. Well, for some men, maybe you should be going to your GP and being tested, have your testosterone tested. It's rare. You know, I ask every one of the patients here, have you been tested? And most of them have, and there's nothing wrong. But it could be, there will be someone who's experienced a very low testosterone count, and that could have a real effect on your libido.
Definitely, women and men.
But things like alcohol, drugs, yes, on one side maybe they can stimulate you, but on the other they can really create a pall over your libido. If you use something too often, too much, it's like Viagra. I mean, if you take it every day, 5 days a week, I don't know what it will do to you, but it probably won't work.
I think the thing that I was quite surprised about in terms of Viagra was if you take it, you don't automatically get an erection. You have to get really, really aroused. You have to get something that triggers off your arousal. It doesn't just automatically come just because you take it. And also sometimes it doesn't necessarily, I mean, I would always suggest to somebody that they talk to their consultant. If you're thinking about using Viagra, I mean, that's great, but talk to your consultant first, because some things, you know, they are contraindicated, or they just kind of adversely affect the meds, and so it would do something quite opposite to what you want to achieve.
Okay. Now, I don't know how many of you have heard of Sensate Focus. This is it's something that we both know very well. It's a therapy that we encourage all couples to participate in, and it's actually about touching. Now, I'll just give you an example. What we'd say is, okay, fresh. You have a shower, so you feel fresh after the day, and you have to touch your partner as he or she asks you to touch. So this is where we get to the point of, how do I know what sort of touch I like? What does she or he like? You've got to ask. So if you're with a partner, the partner's telling you, I want to be touched on my back, I want you to roll with your knuckles down my spine, I want you to touch my bum, I want you to touch my feet. You've got to do all of that. And you can touch 5 minutes on one side and then turn over and do the other side. But you both have to participate in this. Now, what will this do? Well, gradually you'll lose your erection, even if you've got one, because it's not particularly sexual. But what we're doing here is perhaps opening up something that's more intimate. Now, intimacy can be very frightening, anxiety creating, and I've worked with a lot of couples that I think struggle with intimacy more than with anything else. Drugs, of course, mean you don't have to struggle with intimacy. When I say intimacy, he or she is that close, right in front of my eyes. I feel comfortable being with him or her. I don't feel I've got to back up against the wall. It's being comfortable with someone, so you feel trusting, free, and willing to try something new. I don't know if you'd add to any of that.
Well, really, I suppose it's about slowing everything down. You know, a bit like going back to basics. Like when you first met someone when you were 16, or when you were allowed to have sex, when you were first touched or connected with somebody, and you felt that kind of exhilaration and that kind of electric kind of feeling, that kind of electric shock when someone touched you. It's a bit like that when you're feeling attracted to somebody, but you've slowed it right down, that you kind of got into this excitement of just, you know, feeling like you're on, you know, you're just on, you know, you're kind of tenterhooks kind of thing, you know, kind of really excited. Sorry, I'm getting excited as we're talking, but just taking it right back to basics with somebody touching you in a very gentle way to get you slowed down.
Yeah, and I guess you don't always have to do it in a quiet, gentle way. You could be more assertive with your touch, but it's not a massage. So it's not a free sports massage. It's actually trying something new. And if you really want to get close to your partner, it's one way of doing it, as long as he or she is agreeable.
It's the sensual part, I think, of Sensate focus, really, that
I agree.
think is great. It's getting you in touch with, you know, sensuality rather than sexuality, you know, sensual rather than sex. So it definitely will slow you down.
So what will help you achieve some of this? I mean, I think first of all, self-care, and we've already really talked about that. It's starting over, exploring what you want.
Yeah.
I think you were talking about the relaxation side, weren't you?
The relaxation, yeah. I suppose slowing you down. I mean, we kind of talk through with people about how they could relax, and you know, whether it's on their own or with their partners, and all these things. You know, meditation, yoga, Pilates, they all help you to get into relaxing. But also, even just walking down the road. You know, saying, I'm going to walk for 20 minutes down the road. Not that you're going to do a pacing run or fast walk, but just a slow walk, trying to look around you and acknowledge, you know, what is around you, kind of a nature walk in some ways, so that you're not putting pressure on yourself to do so much and do more. Because again, if you're stressed out by whatever it is, you're not going to relax. And lots of people, they get into being anxious and they can't switch that anxiety off. But actually you say to them, well, what have you been doing about it? They actually don't do anything. So it's bringing them back to, you know, what could you do to help yourself? And relaxing is a bonus. So, the breathing,
Yes.
I think we could go on to Kegels, really, which...
Yeah, okay. I mean, I don't know if anyone here has ever heard of the word Kegel, but it's, have you heard of pelvic floor? You heard of a pelvic floor? Yes, most women will hear of a pelvic floor exercise. For the males, it's Kegels, and it's named after a Dr. Kegel, who was an Austrian, and who worked with Sigmund Freud. Not that that's terribly important now. But a lot of guys come to see me because they've got premature ejaculation, or they want to last longer. If you do your Kegels, you can do all of this. But you've got to do 80 a day. I always enjoy saying that, because 80 a day, how the hell do I do 80 a day? You can do it in brackets of 20. And what it is, if you just think of your bum for a moment, clench your anus, just clench it shut. Hold it tight, then let go. So clench, hold, let go.
Women
That's a
can clench
Kegel.
their vaginas. They can clench.
Is that what they do?
Yeah, we can clench our vaginas and our anus area.
Together.
I think when you pull it up, you'll notice it. And you'll notice it because you'll start feeling differently. You start pulling up where we're talking about. You'll start feeling the blood supply going around. You'll notice how it feels kind of much more kind of, you'll feel lubricated actually. I think if you keep doing it over time, you'll notice the sensual feelings there. So, but
And actually, for men, if they do the Kegel, when you clench, you can get just a sexual little pinprick. It's just so if you clench your anus very tightly, there can be a sexual feeling. It doesn't do anything. You're not going to have an erection, but you might just start feeling a little bit more sexual. Sometimes if you feel a bit more sexual, your whole demeanour changes. You're more alive. But it's not going to embarrass you. I always say to people, if you're on the train, on the bus, do your Kegels. Or you're at a meeting and you're bored stiff, do your Kegels. 20 at a go, 80 for the day.
You don't have to do them immediately. You build up to it. You build up to it. But you will notice a difference.
Yeah.
And also for women, it's the pubic muscles in there. And the more that you do them, the stronger it gets. You know, when you've had a child as well, those kind of muscles kind of sometimes get loose, but you can get in touch with those muscles again by doing the Kegels.
Yeah.
But you definitely will notice the stimulation, the feeling it gives you, because the blood supply is going around.
And for men, you're directly exercising the muscle behind the perineum.
Yeah.
So when you ejaculate and you feel everything lifting, usually your balls lift and you feel a tightness before ejaculation, that's actually what the Kegel does. So you're just exercising it. So if you haven't had sex for a while, a Kegel's the next best thing.
So if you want any information, you can see us afterwards and we'll send you some Kegels exercises. If you need help, definitely come and see us and talk about it. It's good to just share how things are, and you're always going to need help.
Yeah, I mean, we're putting up some of the ways that you can get help.
Viagra,
Cialis now, or sildenafil, you can get much cheaper. It's £2 basically a tablet now. You don't have to think of paying £8 or £10.
But see your consultant first.
Yes.
Definitely.
Oh yes. The vacuum pump can be really useful if you find it difficult.
Yes, it can work.
It does work. Yeah. And you can get that from a GP for a prescription charge.
Yeah.
Condoms. Sometimes I think people really have to practice putting condoms on.
Definitely.
Because the anxiety that's attached to them, the tearing in the packet, you're putting it on the right way. Well, some of you may put it on the right way first off, but others, I think, don't, from what I understand. So it's losing desire, not getting panicky, just stay there, just deep breathing, bring it back. These things might sound very easy, and they're not. I do appreciate that. But they're part of a program, and if you practice some of them, I think you'd find that sex would be very enjoyable if you're having problems. And you might not be having any problems. So, it's just thinking about ways you can help yourself. Reading erotica, sex toys, cock rings, visual stimulation. It's all part, maybe, for you, how you can enjoy life in a more varied way. But just to finish, you need to take precautions. You need to look after yourself. So thank you very much.